We move voluntarily to feel good, we move to get stronger, we move for peace of mind, and some of us move involuntarily, repeatedly. Hello and welcome to Tick Fit the podcast, a podcast where we discuss all things movement in both the exercise sphere and in life with Tourette syndrome. This is a platform to discuss Tourette syndrome and its effects on our bodies. We'll speak with movement professionals where we can advocate and educate about Tourette syndrome, while the Tourette community can benefit from the expertise of these individuals. We'll also speak with professionals about Tourette syndrome and other tic disorders. I'm your host, Raquel Cunningham, and I've been on a quest for the past 2 decades to discover the connection between movement, exercise, and our ticcing muscles. This is not meant to diagnose or treat Tourette syndrome. There is no cure for Tourette syndrome. We are here to advocate and educate about Tourette through conversation, and anything in this podcast is for informational purposes only. Please always consult with your doctor before beginning any exercise program to make sure that it's right for you. Hey, everybody. Welcome to today's episode where we have Katie St.Clair. Katie is a movement expert with over 20 years of experience coaching individuals, groups, and athletes. And as a former gymnast and lifelong athlete herself, she knows firsthand the challenge of chronic pain and improper movement patterns. Her degree in nutrition and exercise science, combined with several different advanced certifications through the Postural Restoration Institute and strength training certifications through NCSA, have equipped her to create programs that restore function. Hi, Katie.
Hi, Raquel. Thank you so much for having me. I'm excited to talk today.
The same. I'm so grateful. I know that you are, selective of doing interviews like this, and I'm just so appreciative that we can discuss your body of work. So you have a program called Empowered Performance. How did you come up with that? What went into making this program?
Oh, I'd say it was a sort of a culmination of me almost quitting my job as a trainer, feeling frustrated in my own body, and then realizing there was a path forward to learn more and understand more about human movement that could have major impacts on how I was feeling and how I was able to help my clients feel so that I didn't feel like an imposter. And I sort of went through this process of really diving into continuing education, reading research, reading a ton of books on anything I could get my hands on regarding biomechanics, respiration, the central nervous system, the autonomic nervous system, fascia, anything I could find. I mean, I was just I became like obsessed in a way. And I think sometimes that happens when we have really big moments in our life where we're meant to change and grow. If we don't become obsessed, it's harder to get to the other side. And I needed enough momentum. It makes me think of if you're trying to lose weight and you get that initial 10 pounds off, and then it makes you want to keep going because you see the results. But if it's so slow and it's a pound every 3 weeks, it sort of dims the light a little bit. I had this moment of extreme bright and everything open, and I just was open to learning as much as I could. And then I realized, wow, this is something every movement professional could benefit from if they knew a little more about it. And it's not really talked about. The sphere of this side of training and rehab and performance is very, very small in the scope of the big fitness industry that's out there, or the general, post-grad education systems that are out there. There's still, yes, they're research-based, but a lot of that research is 20 years behind what's happening now. And so I just wanted to create something where movement professionals could think outside the box and trust their intuition and use the research to guide their decision-making and learn how to not just listen to my system or learn about that, but be able to take what they're learning from me and make it applicable to what their movement, their love of movement is. It doesn't matter if you're a Pilates instructor. It doesn't matter if you love yoga. It doesn't matter if you like to strength train. I don't care. Whatever you want to do, because the principles apply all over the board regardless. So it's interesting to talk to you. And we were talking before, I don't know much about Tourette's, but you were saying, even if you just understand movement and you try different things and get the body to prefer moving in different ways than it maybe is normally revved up to move into all the time with tics, or honestly, think about normal people that don't have Tourette's that constantly move in these repetitive patterns over and over and over again. And so what you were saying does resonate with me. We're just giving them a different alternative to what they're experiencing all the time. And so then that just led me to really dive in and create this course and go all in on it. So that's sort of what, where my background is from that.
I think that's it. When you can speak the language of movement, which there's not a lot of, and then finding your course, and you can find Katie on Empowered Performance. She has YouTube, she has Instagram, and then she runs a course, she runs workouts, and all of it is the language of movement. There is this overlap of repetitive movement in tics. There's this overlap of repetitive movement in overuse injuries.
Yeah.
Like that's the same course here.
Okay. Yeah.
Right. Only difference being that we don't know to what extent we can help with tics, reducing tic intensity, urge, or frequency. But if we can reduce any of those by making the body, giving the body different movement options, as you say, it's this wild west of unknown. Can this help? Can it not? And can we study it?
Yeah. And I go on to say that kind of my mission, or the thing that always brings me back to why I've done this for so long, is to be able to create a love of movement for somebody. Because if you can do that, it really changes their trajectory in life. If someone doesn't love to move, find a way to help them love it. And maybe it's not me. Maybe it's not, I'm not the person to make you love it. Maybe I remember this great client of mine, Carolyn. She was with me forever. She did a lot of strength training. COVID hit. All my clients went, online, or they just stopped working out. And I was talking to her. I was at this jewelry store she works at. And she said to me, Katie, I have fallen in love with Pilates. And she said, I do it 2 or 3 times a week. It's amazing. I feel so good. It feels good on my joints. Great. You know what I mean? You're just finding something that makes you want to come back to it over and over again, because consistency over time is really what creates change. And having different experiences of movement, not just always doing the exact same thing over time, but like really allowing the body to feel safe in a lot of different aspects, I think is key. So I overcomplicate everything because I'm trying to teach, and I'm, talking about anatomy and trying to take theory and make sense of it and all of this. But if I step back and I look at what I'm really doing, I'm telling people, here's one way to move into this. Here's one way to move out. Here's how we can expand our scope of movement at different joints globally through our body. That's it. And then we're just playing and learning more about why that might be. But we can't ever say why, right? Because
there's too many variables.
Exactly. I may say it's because length tension relationships have changed, because the way that the joint is positioned now and where it's sitting. Or I could be like, well, maybe that joint's like that because it's creating a protective mechanism because something in the gut isn't working. I don't know. So part of it is guessing. So I really do like the fact that you're open enough to be honest about, hey, I'm not saying this is right or it's going to fix anybody's symptoms. I'm saying, let's try, give it an option. And nothing's going to create better health outcomes than being able to move. Right.
Oh, well said. Well said.
Toilet,
It's interesting. Twice in there, you referenced, I don't know if this is the right program, if this is the right one, but the love of movement, you opened up that path that client of yours could then find something that she loved to do.
Right.
And I'm going to hit you with something crazy right now. For you saying that you don't know if it's your program, the reason I made TicFit, and my TicFit programs are for the Trek community, but a big part of why this podcast exists is you had an inspiration in that.
Oh,
I wanted to make a table that I could bring movement experts like-minded like this, that we could have these discussions. And when I found you a couple years ago, I'm like, we need to talk and we need to let the Trek community hear this. So
thanks.
Yeah. Well, thank you for being here. Human movement is complex and it's beautiful. And it's just something we all need to do and pursue. And what doesn't work for one will work for another. And you just keep exploring to figure out your own movement patterns.
Mm-hmm.
Right. And what I love about your programs is you have this how did I word this the other day? I also like to overcomplicate things. It was a very wordy, I love your progressive playability with movement options.
I've never heard that before. Progressive
You're well.
playability.
That's what I love about your work, and I
What
love
does that
about your
mean
program.
to you?
It means that you can enjoy movement, and you can base it on something. Okay, my body moves this way. It enjoys moving this way. It's getting strong this way. How can I progress that while still enjoying it?
Got it. Oh, I love that
You
term.
know, you don't have to just do more weight to get the same effect. It's you have to enjoy movement while creating adaptations.
Yeah. Yeah. And if you hurt and you have pain or you're getting injured all the time, then it becomes really hard. And that's where it's important to take a more strategic approach to try to help someone improve or expand their movement options and find new ways of moving so that they don't hurt, so that they can continue to do what they want, or at least find a way during those times to continue moving, even if it means um, altering things a little bit, and having to take a
Right.
step back. So
So something I really wanted to talk to you about today is rotational patterns in the body. I've been searching for a skeleton marionette, because first of all, I love that visual that, tics are external, it's neurological, but when they pull the body in these positions, I mean, the body has to almost stabilize with some kind of compensatory pattern to satisfy whatever that sensation is that that person needs. So these compensatory patterns that are happening, put this rotation on the body. And I'd love to discuss just kind of general rotational mechanical movements that would be the least intrusive on repetitive injury, if that makes sense. We kind of looking at the joint by joint approach. You know, atlas and axis should rotate. Lower cervical should be stable. Thoracic should rotate. Lumbar should be stable. Pelvis should rotate. Knees should be relatively stable. So if we were to break that down, as a water polo player, bizarre body mechanics, absolutely bizarre. And then when I became a land athlete, nothing rotationally made sense. And I didn't even learn until, even as a trainer in this career for 15 years, maybe 4 or 5 years ago, just the extent of how much the pelvis should drive rotation.
yeah.
So, you know what I mean? So let's just start with the pelvis. When the pelvis rotates, what else is happening there?
Well, I'd almost say it in because my brain kind of goes to the diaphragm and then that explains the pelvis.
So then
So,
let's start there.
yeah, because I feel like I can't even explain it correctly or well enough to be understood if I don't explain that first. So, if you look at the diaphragm, it sort of has this rightward pull. So the right side of the diaphragm is more elevated or exhaled. So when you exhale, your diaphragm domes up. But think of the diaphragm as having two sides. And really, I think of it as quadrants, like two sides in the front, two sides in the back. But let's just
Interesting.
say two sides to keep it like that. And so as that right side stays in a more descended, or I'm sorry, ascended position, so up, an exhaled position, that is very common in most people because we have a liver that sits underneath it. On the left side, we have our aorta, our heart that sits above the diaphragm and it pushes down on the diaphragm. So that diaphragm is in more of a descended position. Will your audience see me or no?
Yep. We've
Okay.
got this on YouTube and then anywhere. Yeah.
So much. So I've got a left side that's more descended, a right side that's more ascended. And when you look at the diaphragm, if you were to cut somebody in half and look up into their thoracic cavity, it looks like the crus, and the crus is the part of the diaphragm that attaches on the spine. And so there's more of this rightward pull and it creates like a spiral that comes around. So everything in our bodies mimics a spiral. I always in my course relate it to seashells. If you've ever heard of like the Fibonacci spiral or anything like that.
Yep.
And those laws of physics apply to what's happening internally. That movement of the diaphragm is the same thing as stepping forward in gait. It's a suctioning with a twist, if you will. Like imagine I swirled around a glass of water and then it just kept going. That's kind of how I imagine it. And so when I take an inhale, I'm creating a push down from that diaphragm with a rightward spin into the pelvis. And then as I exhale, it's like sucking the guts back up. And each time there's a drag. Imagine walking through like a river that's flowing. Let me think about this. Flowing to the right, so it's hitting me on my left side. The
Okay, I
river's
see.
creating like a push, and I'm trying to fight that. And a lot of the compensations I think that we see is trying to create that fight against that right pull. And there is a cortical dominance of the right side of our bodies, our left brain, to be more oriented towards that side. And so what happens is there's generally a change in the way the pressures are managed down into the pelvic floor. So on the right, I can get a better suction up, and on the left, I can get a better push down. And so the pelvic floor and the pelvis itself, I'm going to have more pressure pushing down in the left side and able to pull pressure up on the right. And that also alters the way that the internal dynamics of the pelvis are moving. So you have the ability, and that subtle movement, it is subtle. And a lot of people will kind of challenge this and say, oh, the SI joint doesn't move. It only moves 3 millimeters. And so there's no way you can change movement with that. Well, I can tell you, if your SI joint doesn't move at all, you're not feeling good.
I can tell you that thing hurts, whether it's up or if it moves too much. Either end of that spectrum. 3 millimeters is a lot. That hurts.
It is. And if you can get that little wiggle in the sacrum, then like you said earlier, your lumbar spine shouldn't be rotating that much. So if you can get the pelvis to rotate, the sacrum to wiggle, the lumbar spine doesn't have to take on so much work. A lot of the times, the ligaments that attach, the iliolumbar ligaments, they attach the lumbar spine to the pelvis, those can get overstretched. And then you have a lot of motion through that area that's not really meant to take on all that motion. And so from a movement perspective, every single joint rotates and should rotate, every single joint. And so if we understand, though, from that thoracic cavity first, and we improve the ability of that left side of the diaphragm to come up and the right side of the diaphragm to go down, we're changing that flow of the river. We're changing that spin of the internal pressure dynamic. And that is what sets the foundation for joints more distal or further, elbow, wrist, knees, feet, to actually not have to take so much rotational capacity because we've lost the internal dynamics.
I have never heard it explained like that dynamically. I've heard a lot of great explanations about the diaphragm and the two spheres, and I heard it referred to as a piston system, which it is. But to your point, this suction pull through movement makes so much sense.
Yeah, and it's wild when you wrap your head around it. You start to see the body as not rigid levers, but this fluid exchange of pressure, lungs, air pressure, cranial pressure, and all these different fluids. All we are is just tubes inside of tubes inside of tubes. And we're just managing that.
Right. I was explaining to you, one of my most persistent tics is still like a sniffle, snort, and then also a belly tic, where basically I'll either bear down or push out. And when Jill was on, I was explaining to her one of my tics when I was younger was sucking in the sides of my stomach, which
interesting. I'm doing it right now.
Yeah. It's and then she showed me this crazy Nali Kriya thing that it's like an intense yoga move.
Yeah.
And I'm like, that's just, my body was trying to do that. And then playing water polo, where I'm kind of doing these, I'm not going to say mal mechanics, but there's nothing in water polo that translates to land when you're egg beating or treading water, turning inward, unless you're doing silks. That's a similar movement. But I mean, had I known about your course, why didn't you make this like 15 years ago? Really could have used it.
Because I didn't know about this 15 years ago. That's when I was starting my journey and learning about this stuff.
Well, I mean, thank you for making this, because I mean, this is kind of just the pioneering of looking at movement like this. But if you have somebody that has, I do personally believe that anytime somebody tics, their breath is stalled. Not everybody has breathing tics, but there are other tic disorders that don't encompass the one breath, one vocal, two motor. But for Tourette, it is one vocal, two motor. And I think all three of those affect the diaphragm. And if all three of those affect the
Causes the
diaphragm,
diaphragm in a certain position, or just in general, like how I can see what you're saying, because if I cough,
yeah,
it's an immediate pressure pushing down, but it's also the diaphragm is sort of constricting a little bit to manage that or something, because the face
right.
sort of closed down, intercostals kick on, and you get that rigidity.
And so all of a sudden there's just tightness in strange places, or even, gosh, there was one time I had a really horrific, I don't know if it was the cold or the flu, it might have been the flu, but coughing nonstop. And like my back muscles got so seized up and so tight, like, and it was reminiscent of when I was a kid. Yeah. Reminiscent of when I was a kid and I had these way more intense tics, and there was nothing that I knew of to release that. And if we can do that through movement, again, just to feel better, if anything, or as a recovery tool after a big tick storm, that a tick storm or a tick attack is what they call when they're just coming full force at you. There's really just the height of frequency and intensity for any length of time. But what recovery movements or tools do we have at our disposal to reconnect? Because all of a sudden you're almost at war with your body a little bit, and there's got to be something to gently move back in your body, remind you that it's yours still.
What does the research say about why you'll have episodes like that where
That's a
you're
great question. I don't know that, actually. Like, what brings on a tick attack?
Mhm.
That's a great question. I don't know. We know that the basal ganglia is involved. Research and brain imaging has shown that. We know that there are common tick triggers: stress, lack of sleep, even excitement. But finding kind of that individual trigger for the person. But as far as when like the big onslaught comes on, I don't know. I'm going to write that down and look into that.
Well, it's just interesting because is it a nervous system
Yes.
issue that's happening? Like most things, right? I mean,
Right.
if I'm really tired, I can get really weepy, or and feel like I'm out of control of it if it's been days with bad sleep. And and it doesn't take much, to be honest. Like if I have like 2 or 3 days of bad sleep, I'm
Oh,
kind of
yeah.
a mess. I mean, it's crazy. And then you add some sort of neurological component that we don't know. It sounds like we don't know enough about onto that. Because even when you don't sleep, right, your nervous system suffers from that. You live in a more fight or flight, or you have some sort of
Bingo.
trauma. And so it's really interesting. It
That's
makes you
why
think so much about the body, though, and how important it is to improve your respiration and your ability to breathe easily at rest. And beyond, even, I mean, I do a lot of breathing drills and like breathing into certain parts of the rib cage and incorporating breath into the big movement patterns. But even focusing on some nasal breathing, steady state cardio might have a big impact for these people too.
totally. I will say the limited research on exercise physiology has mostly been cardio in nature.
Oh, okay.
And there's something there. Everything else is, anecdotal, but I do think that they're starting to explore more. And it's
Yeah.
interesting that as we describe this kind of from a residual effect on the body,
Mhm.
like even you not knowing much about Tourette can still kind of get to the same place that I am, where I do know Tourette and movement. We get to the same precipice. Okay, what can we explore about this? So if we kind of go back to your I like to use my hands to talk too. This represents the diaphragm. This is the pelvic floor and the pelvis. So if we have this gait cycle here with ascension and descension of our diaphragm here, what are some of your go-to breath movements, and what exercises do you love for rotation to introduce that to the body?
So when I work with people, regardless, I usually start with an assessment, and the assessment tells me where there's areas of restriction within the rib cage or potentially the pelvis not moving optimally. A lot of times the pelvis is just coming along for the ride. So there's a push forward of the rib cage because there's compression on the backside, or what I call a pulling back. So the chest wall compressed, pulling us back. The pelvis sort of orients along with that. So if I've got, a lot of extension in my back and my ribs are flared in the front, my pelvis is going to tip forward, right? So if I minimize the compression within the rib cage, usually I'm going to find a lot of change that's going to be beneficial to somebody without having to do much to the pelvis at all. Now, sometimes there's a lot of restriction in the pelvic floor just from holding tension. And every time you cough or you sneeze, or it sounds to me like even have a tic like that sniffle, the pelvic floor is probably going to clench. And so as it becomes tight, it makes it harder to get that wiggle of the SI joint and the sacrum moving, like we talked about. So then that would be like my second strategy, is managing that. So in terms of like my go-to to improve that expansion, which will improve rotation, it's as simple as breathing into your back I could lay someone on the floor, put Jill's Coregeous ball underneath their rib cage in the front, and just have them breathe into their back. So it's sort of holding. That might be a very simple something for your audience to try. So I'm just laying flat on the floor, prone, put my head on my hands, and then take a ball or a yoga block and lay over. Yeah, exactly. And then lay over it on these lower ribs. So it's going to hold these down. So then when I inhale, my back gets bigger without my belly coming forward and getting bigger. And then from there, once you get more space back there, you can learn how to use motor control to help you keep the tension in your abs in the front to do the job that the ball was doing, to then be able to inhale into your back. And when those ribs can move back in space, it allows for thoracic flexion, which equals rotation. And then in the chest wall, we can do the same thing. So I could lay on my back and I could focus on exhaling and getting my lower ribs to come down, hold some tension in my abs, and then I can actually do the same thing. And that's not chest breathing. It's not like my autonomic breathing. I'm using my
It's not up here.
Yeah, without my neck, to expand the ribs in the front. So I'm improving the rotational component of all sides of my rib cage, so that my arms can move up and down easier. I can rotate side to side easier. And those are two really simple starting places. If anybody is interested, they can go to my YouTube, and I have tons of basic breathing drills that really they don't take a whole lot of thought, and they are a big bang for your buck without having to know your potential, like your actual assessment, exactly what's going on with your body. Some people don't necessarily need that. Sometimes they just need to get the motion back throughout the entire rib cage and get the diaphragms coordinating really well. And then all of a sudden things start clearing up.
I think that has huge implications for so many things. Improving movement, whether it's a physical motor tic that's most bothersome to that person, whether it is the vocal breath tics. The implications of that for vocal tics, I think, is huge.
Yeah. And there are really amazing people that study how, Chris Kelly is a friend of mine. You can find him on Instagram. What is the vocal? Oh my gosh, it'll come to me. Anyway, his wife is an opera singer, and they created this whole business around improving airway to improve vocal performance, using a lot of these principles of respiration and movement to learn how to pressurize the system really well, so it moves really well, and so they can get those notes out without things like incontinence, pelvic floor symptoms like prolapse that happen in singers, because they're forced to kind of create this pressure outside of their body to put these big notes in. And what that amount of force is doing from the inside out is quite a bit. So there are people way more knowledgeable about the the cranial bones and the airway, like Chris, that you can also check out, that might be helpful, because it is interesting that, it's like a cough or a vocal tic that's combined. What is it? Is it something in the airway like that is restricting it? There's another person, Project Airway. His name's Greg. He's fantastic. He's really looking into research about changing the airway at a young age for children, and going to dentists who understand how to fit a child for braces, not just lock down their teeth, but improve their airway health. Like my son's getting a palate expander that's very specific to his airway before he gets braces, because I don't want to just close his teeth and make him look perfect, and then he has an airway issue later on because his palate is too small and his tongue can't fit the roof of his mouth. So your tongue can't fit to the top of your mouth. There's no way you're going to breathe optimally. So
that's fascinating.
Yeah, I mean, it's a rabbit hole you can go down. I've taken a few cranial courses, and I still am like, I have no idea. Like,
at some point, right? Like, I think we can get to that point of knowledge. Like, you don't know what you don't know.
Right.
And then you keep asking questions.
Yeah. And
right.
I dabbled in it for his sake, because he had an accident where his cranial bones were all fractured in his skull and his face. And so, and he's fine now, but it's something that I wanted to explore more so I could learn a little bit about in order to help him now and in the future. But from the Tourette's perspective, I think it would be worthwhile for parents. And, this is just me saying this because I would tell any parent this at this point. I tell my friends, like, if there's a dentist here that I'm sending my son to, an orthodontist, who's done a ton of training in airway. And the reason, I have to drive to get to her, but I think it's important to start young, because I think these airway issues are part of these movement compensation patterns that we're seeing in so many people. And you can see more recessed jaws, maxillas that are sort of not developing and coming forward enough. So you're sort of closing the airway off in that way. And it is probably changes due to, nutrition, whatever is happening as we change our species, over time.
Right.
And so I just think every parent should find a really great dentist or orthodontist who understands airway health for their child, and at least go for a consult and learn a little bit about it. It's amazing. So when your kid's getting closer to 8, 9, 10, go to that orthodontist. If your kid is not sleeping, if they are wetting the bed, when they're older, 5, 6, if they have enlarged tonsils, adenoids, all of those things are going to impact. Mouth breathers. Yeah, these are really important things to try to catch early if you can, because it reduces those compensation patterns. They may be happening really young.
I think that's incredible. I didn't even realize that would be a question that I could and should ask an orthodontist. As my kids kind of age into brace land, I am appreciative to know that. And
it's pretty wild. And there aren't a lot of people who understand it. So we were talking earlier, and I said, in this world of what I do, it's pretty niche, but that is very niche.
Yeah.
So Greg's a great one to follow. But there are others. I can always give you recommendations if you're interested. But if I had a child that had Tourette's, knowing just from what you've told me today, that is one thing I would 100% look into. And I'm sure parents are like, kind of, when they have a child with Tourette's, are thinking to themselves, how do I help them? How do I help them? I want to fix this, because I know with my son, anything that's wrong, it nags at me. I just want to help him. I want to fix it, and we can't fix everything. But so I'm just throwing that out there, because I would imagine this is something that, you see early on, right? I mean, how old are most people diagnosed?
You can be diagnosed as early as 5. Is kind of symptoms might present before then, but it's really hard to distinguish what's developmental, what's not, but usually around 5. And then speaking with a neurologist, she was saying that the average age of diagnosis takes 3 to 11 years.
Wow.
So that's a huge window in there that either you don't have access to a specialist with Tourette, or you're unsure because it presents so differently. So
Right.
Google, is this movement Tourette? Don't know. What else is it coupled with? What else is going on? But there's other things that you could be looking and exploring and, again, helping. Like, who doesn't want to help their kid?
Right. Exactly.
Yeah, I think that's really helpful. And then everything we talked about, the diaphragm and breath too. Now all of a sudden there's something like actively working against that. It would be
Yeah.
helpful
And
to
I do
know.
breathing drills with my son. I
Yeah.
mean, he loves when I, not loves, but sometimes like
Yeah.
he noticed certain things in his body, except especially after his accident, where he'll have me and he can now hold his breath. It's something crazy. I think he told me the other day it was like 2 minutes.
Really?
So he's really worked on
Good for him.
rib cage and yeah, and he'll like crunch down and getting these positions that I'll use and breathe. And
We
he's
do
only
breathing drills with Mike. I'm sorry, how old is he?
he's 11,
Yeah.
So kids are actually, they look to us to tell them what to do when they're young. So if we
Right.
start really young, they'll think it's normal versus trying to convince them when they're teenagers. You know?
I frequently have to go track down my gorgeous balls throughout the house. We do breathing drills
Oh,
in our
lovely.
house too.
We,
And it'll be in one of my kids' rooms. And
yeah. Well, it
it's
calms our nervous system,
yeah.
Yeah.
It's funny. I didn't realize find in my mission here, in my whole endeavor, I knew that breath was the first thing that helped me because I was a swimmer and it would disrupt my swimming. But ironically, breath work was the last thing that I really studied. I just kept chasing movement and chasing movement and chasing movement. And so when somebody else actually introduced box breathing to one of my kids, and they took to it immediately,
Mhm.
and when they start doing it on their own without being prompted, you know that they're enjoying it and it's working. And, it's just this tool in their tool belt that they found.
Exactly. I mean, I wish I had that strategy when I was young. My son got upset yesterday because sleepover was canceled. The devastation. My God,
Right.
I've been excited about this for a week, and I could see him on the couch, and he was going, and I was like, "That's amazing." I would have never known necessarily that was what that actually was, and they should be teaching this stuff in schools, not to keep going on about kids, but it's just because I can imagine with Tourette's, it starts young
Yeah.
and then you're trying to manage it through childhood and kind of figure
It's
out.
true. But then, okay, so for kids, we, try to start young. And, if you're listening to this, you either are interested in movement or you have Tourette or you work with someone with Tourette. But if you have not started early, older adults still have tics as they go on. Then I think that's why it's so important to move and feel your body moving and have different movement options that might give you access to a new spot on your body.
Yeah,
We have this amazing machine, and when, like you said, and I keep using that phrase, movement options, more movement options you have, the more likely you are to find something that resonates with you. And when you get that tactile input, that does something else too. That's neuroplasticity.
right. And I
Right.
think, I know I talked a lot about the breathing, but another way to look at it, especially in the fitness culture, sort of that mainstream fitness culture, you'll see a lot of things like hit workouts, going through stuff really fast and getting the burn and, making yourself feel sweaty and exhausted. And while there is a place for that because our bodies are meant to be adaptable, there also needs to be a large place, in my opinion, on movement that is about quality, slowing down, being able to breathe in and out of your nose while you're doing a movement, having enough rest between sets and exercises so that I can go down in a split squat, take a full inhale, feel the expansion in my body, and then exhale as I come up and use the breath to help change and improve those movement patterns. And that can go a really long way. You don't have to be exhausted to get a good workout. And in fact, I would say if you're not exhausted, you're going to recover better and you're going to be ready for your next workout much sooner. And so, one of the biggest things I always teach to people is just slow down and breathe through the workout. Don't just run through the motions and not think about what you're doing. The breath and the diaphragm are the foundation of your movement.
I think I was very much that person who was looking for the leave it all on the gym floor. It doesn't count unless you were drenched in sweat and couldn't move. There's
And
really
I
been.
coached people like that for years because that's what I was told got results. But what are the results people are looking for? Just to burn a bunch of calories?
And then not be able to work out for 2 to 3 days.
Right. Or
you
get
know?
injured and then have to take, 3 weeks off yeah. And and I was sort of kind of moving it, and that was my early career, but I was sort of moving in that direction. And then my husband at the time was in physical therapy school. And so I naturally started to, I guess, gravitate towards that rehab space a little bit. And I ended up being like the trainer at the medical university here, where physical therapists would send me clients because they knew I was taking an approach of at least being careful and intentional with the exercises. I didn't know any of the things I know now, so I couldn't help people the way I do now, but I knew enough to either avoid movements that didn't feel good for somebody or caused irritation and provide alternatives, and just slow down and try to coach a little bit better. And that definitely had huge benefits. And then kind of realized, gosh, I'm seeing so many of the same things in people all the time. Like, why is that happening? What's going on? And my own body was hurting like crazy. And so, after the birth of my son, well, then my body was just, I was like,
It's just different.
starting over now. I might as well learn everything I can. But yeah, and now it feels so empowering and so wonderful to be able to have this knowledge and create change using many different modalities, not just the breath, but like I said, regular exercise, intentional, choosing things that work for people, understanding why they're moving the way they are, understanding their compensation patterns, and working with them to try to improve their options, so that they love movement again.
Boy, do I get that. I think it just dawned on me now. That's the like-mindedness, because I also was a PT aide for many years, and that was my first intro into movement. And, again, seeing the same thing, seeing the correlations, and then building upon, I do just have this obsession with joint angles. And then learning, okay, well, how do your hips do that? How does your shoulder do that? And building and growing on that. And I think any trainer, the way that somebody trained somebody 10, 15 years ago is very different from now. But to go through that same, this isn't working, but this is. And I think that's very, very cool. So really through like learned experience, and then, that sponge period where you were just chasing education has really led to, what you're doing right now with empowered performance.
Yeah, it really has. And, I think as the industry is continuing to evolve, this stuff is going to become much more mainstream. So more people will have access to it.
Yeah.
The problem right now is people will ask me, well, how can I see someone like you in person? And I get it. Not everybody wants to do an online thing. And so, I'll say, I'm sorry, I don't know anybody in your area. I have lots of people who've taken my course. They offer online classes, but I wish it was in person more. And, because I think that's when you can really create this massive change. And we'll get there. I really think the industry will get there. Things like Jill's book that just made so much fascial research and education around movement in the body and how to use these tools that she gives with these, the yoga tune-up ball or the gorgeous ball and all of that for a very low price point.
Yeah.
You can learn for what did that book cost? I don't know. It was like $60, $70 or something.
Something
Huge. So many options. And it's like, this is something that everybody can benefit from. And the barrier is really low. I guess that's what I'm saying, because a lot of people choose to go to, a gym and take classes because they can only afford $30, $40, $50 a month, and they'll find a place where they can do that. But the classes that they're going to aren't necessarily offering them these tools.
Right.
So to get these tools into more mainstream, I think that would be really helpful. It's just hard to figure out how to do that, you know?
But I do agree that I think the industry will catch up to that, because the things that will continue to work will be movement for longevity and loving to move for long periods of time.
Yeah. And
But
there's podcasts like yours where they're starting to offer all this education to people. And God knows we're totally inundated with information.
yeah,
There is some really good information out there. So even if you just listen to, a podcast a week for 8 weeks about something that has to do with movement and respiration, you're probably going to learn a lot about your body.
so true. You'll get caught up, I think, pretty quickly.
Yeah. Yeah.
But I do want to deviate to another topic, because something else I see, and as a gymnast, I feel like this is just going to be a high incident of gymnasts, but hypermobility, joint laxity, and subluxations. What I'm not sure if there is any correlation between hypermobility and tics, or if somebody does have hypermobility and Tourette's, if they happen to have both, how those play. But I do know that I have seen a lot of people that will, if they have like a loose shoulder, let's call it a joint that moves beyond its normal range of motion, there is this extra sensation to further that. And just because it hurts doesn't mean that they're going to stop. It's, somebody might continually sublux something. Or I'm just curious on your take with how you train. I've worked with people with Ehlers-Danlos. It's tricky.
Yeah.
What is your approach to training somebody who's hypermobile? We'll start there.
Yeah. So if we go back to that pressure, we want to sort of imagine I put someone in a box like a mime almost, and I'm creating all this resource to feel and sense the space around me, but also be able to create that pressure pushing out into the rib cage. And if you combine that, you think of like creating an abdominal brace, like a Valsalva before you do a heavy squat or something like that. They're going to have a harder time managing that pressure because all of the tissues within their body, it's not like it's just the connective tissue. It's, their vessels, their, arteries and veins and their gut experience issues because they don't have that good pumping process. And so breathing is still going to be the foundation because I want to teach them how to create that pressure, either squeezing themselves in or pushing the pressure out, inside out. And then lots of references. So let's say I have someone doing a push-up. I'll put their feet on the wall, have them drag their toes up the wall so their hamstrings are on. I'll have them drag their hands down against the floor so they get really good activation of the shoulder girdle. So when they're going through those motions, they're actually creating more stability in the areas where they have laxity while they're able to keep their rib cage a little more mobile. Because what I see in a lot of people and I have worked with people with Ehlers-Danlos, what I see with them is a lot of hypomobility in other places. Arches of their feet, pelvic floor, rib cage, upper cervical, C1, C2, atlas on occiput. Those places get really locked up. And to make up for motion, well, guess what? Lower cervical rotates like crazy. Hip joints rotate like crazy. Femurs pushing forward in the socket. You see what I'm saying? And so sometimes I'm like, we say hypermobility, but there are areas with a lot of restriction. And oftentimes these people will say, I can't even touch my toes. I feel like I constantly need to stretch because they also can't take up muscle slack. And we need to be able to create tension, take up muscle slack, and get that tug of the muscle on the tendon so that can send the signal to the brain that we have tension to be able to use it. But if my connective tissue is so lax, it's harder for me to create that sensation. And that's where using references can help get that stimulation that they need to take out that muscle slack and feel that like co-contraction of their whole body to be able to control the motion versus just compensatorily moving their joints through it.
No. That's a great explanation because I don't think the hypomobility is talked about as much because people will say that they feel tight and stiff. Like, no, you're hypermobile. Like, it's very invalidating when in fact, mechanically speaking, like this kind of reverse joint by joint has now occurred.
Right. And so put a band around their knees, put a ball between their legs, put a band around their arms, like whatever it is to create a little more force or ability for them to push out against something. And in training world, that's called overcoming isometrics that we use. So it's like you're in a closed chain position. Let's say I'm standing in front of a wall and I step back into kind of like a plank and I'm pushing my hands against the wall as hard as I can. That is a way for you to create that co-contraction and stability throughout the body. And I've seen this used with people, and I've done it in my classes where I'll have people create that overcoming isometric and then breathe and allow the diaphragm to contract and relax and take full inhales and exhales. And they'll have an easier time relaxing the pelvic floor while they're creating that overcoming tension, because they're always tensing their pelvic floor to control things and try to limit motion when that's not where they need the motion limited. But if my hips were all over the place, it would make sense that I could use my pelvic floor to create some stability. So I didn't feel unsafe in my body. So it's all about, to me, providing a way for them to feel safe and like they can feel that proprioceptive sensation of that, I guess, and tap into like the mechanoreceptors in their joint by being able to reduce that muscle slack, or connective tissue overstretched, whatever you want to call it.
Right. That makes sense. I think because that classification for hypermobility has really changed a lot too. For Ehlers-Danlos, there used to be only like 4 categories. Now it's, I don't know, last I checked was like 11 or something. Yeah, but it's a thing that people are dealing with. I went down a rabbit hole trying to look up Cirque du Soleil trainers. Like, how are you training them to then still be able to do these motions? You need the longevity of them to perform without, their body falling apart. Like, what were they doing? And it was that, like what you just explained. It was,
okay. Yeah.
Truly just creating stability and safety and figuring out your own proprioception with whatever goal it was that you were working on.
Yeah. Yeah.
But I know it's very, sorry, go ahead.
Well, I just feel like with those people, it's sort of, let's say your only thing that you ever did was yoga and you never experienced a different movement. It's movement variety as well. So when you come out of your circus performance, you then do something different, which is kind of what we started this conversation, talking
Right.
about, providing a different movement option.
Right.
Oftentimes that's enough to keep someone functioning well enough to continue to go in those patterns if that's what their goal is. Like if you're working with athletes, which I would consider circus performers incredible athletes, every athlete has a demand on their body that's going to probably require them to push through limits that the body shouldn't be doing in a way, or it might be, going into more extreme ranges and things like that. There's nothing wrong with that as long as you can come back out of it and recover from it safely, right? And so I don't necessarily want to take those compensations away from people that they're using to perform and be really good at their sport. But I want to make sure that they have strategies to recover when they're done playing their sport and they're not walking around like that all day long.
I think you are thinking long-term with that. Like
you can't take away that if that's somebody's goal in life.
Right. But, it's also like a testament to your approach. There's no, fear mongering. You can't do this for a long period of time or this repetitive injury will happen. It's truly finding a strategy to work with that person and their body and their goals and their genetics.
Yeah.
And
I'm proof of that. I mean, as a gymnast and what I put my body through, and then the amount of laxity within my pelvis was insane. I don't have any of that anymore. So these things, I think the body is incredibly adaptive and can heal itself if it's just given the right movement tools to do it. And I see it over and over and over again. It's just and some knowledge and then trying things that are different. And it's amazing what can happen,
Really incredible. Gosh, I feel like talking about hypermobility and joint laxity is tricky because we almost have to speak in hypotheticals because it is so varied for, what joints moving where, how much. Um, it takes knowledge and proprioception. And what kind of loading have you seen helpful when working with hypermobility?
So I have my own categories and buckets, and I encourage my students just make your own categories of exercises and strategies.
Yeah, what makes sense for you? And
Yeah. So people may hear this and be like, what is she talking about? Overcoming plyometrics. It's like, I just made that term up so that I could have like a system in my own brain to go to.
I get
But
it.
what I think is there's sort of two sides of the coin. There are things that allow our connective tissue to become more compliant. And in essence, our muscles, and there's like this whole side of that. And then there's things that allow our bodies to become more stiff, and not in a bad way. Connective tissue that's stiff allows for free energy because connective tissue doesn't use ATP. It as the muscle pulls on it, it's like creating a slingshot, and then as you release, it's free energy to propel you forward. And so we need enough stiffness. That's why hypermobiles are actually probably working so much harder to move and do things. Their energy consumption is so much more because they don't have the ability to connect into that stiffness that they need. So if we think of two sides of the coin, if I've got like a basketball player with super stiff Achilles, I don't want to do a bunch of pogo jumps that are just going to make his Achilles more stiff. Especially during the season, I want to do things that can help him have some compliance so he doesn't end up tearing his Achilles, right? Or having a muscle pull, rather probably be a better example, because the Achilles is so stiff and that muscle tendon unit is not able to relax the way it needs to. So if we have those two sides of the coin, in my mind, there are certain exercises that can help create more stiffness and more compliance. And so to create more stiffness, I'm going to be doing the overcoming isometrics that I talked about, usually like 10 seconds, like all out effort, pushing against an immovable object. It's a great place to start because it's super safe. I could lay on a floor on my back and push my arms into the ground as hard as I can. And that's an overcoming isometric. And I've just worked lats. I've created that co-contraction ability, and my body can recognize that and sense that pretty well because I'm on a floor, right? And then that would move in to some strength training. And I love use machines, something that gives you those references. Start to build that base of strength, because if we don't have that, it's going to make everything harder. And so those that can go into some more isotonic work, moving through extension, flexion, all of those things within different joints. And then getting into maybe some compound lifts. And there are ways to make a squat more stiff and to be able to create that internal pressure. And so I might do something like a roller against the wall, squatting down and up, like my back on a roller.
Mm-hmm.
That reference. I could put a band around the knees. Now I've got that reference. I could put the weight in the front of me so my abs have to kick on. Now I've got that reference, and then I'm squatting. Like that's going to kind of provide that. And then I take that and move it into more dynamic activities that I consider creating a little more stiffness, like a fast table chop or something like that. So it's just progressing. And then that would lead into plyometrics, and things like pogo jumps help create that stiffness at the ankle where we see a lot of that laxity and rolling in. Pogo jumps with your hands, like you sort of against a wall and staying stiff so the elbow's not locking out, learning how not to go into that hyperextension all of the time. And so I think the biggest thing, just like with any fitness goals, is progressive overload safely over time and just consistency. So I kind of try to think of it in that hierarchical way of moving people through those buckets safely, so that they can move more like an athlete and less like a robot. You know what I mean? But it
Right.
might feel a little more controlled and robotic just to get to that place.
That's part of the plan. That makes sense, though. Like truly. And I mean, your point, like use machines. Like machines have a place in here to get you to that end goal. Like as a reference, you need to be able to feel what it is you're trying to work on in order to move forward.
Yeah. And they provide a safe space. for someone
Yeah.
to do that. Yeah.
I haven't heard an explanation on training hypermobility that cohesively before. So
I've
thank
thought
you.
a lot about it. I put together a whole presentation for my membership. So it's definitely one of those things that I've delved pretty deep into. Just because even if you're not hypermobile, if you lose range of motion in a joint, it's easy to create a scenario where you have laxity within that joint. If I, have a shoulder that's really tight on the back, the head of my humerus can move forward in the socket. Now that joint is a little more compromised. So it's important to understand these concepts, even if you're not working with hypermobile people and you're just working with regular people that have issues too, because the same thing applies. I can use the same
Right.
concept I just said at a local level to improve those joint mechanics and restore some of that integrity of the tissues. Pregnancy is a great example.
Totally.
So much becomes lax within our pelvis. It's kind of crazy. And then we've got to rehab that. Well, if you understand these concepts about working with someone with hypermobility, you can train postpartum people because you can help them create that stiffness where you need and expansion where you need.
That makes sense. Yes, that's another deep dive on topic of having these pelvic tics while pregnant and learning how to, what position did I have to stand in to optimize and not overdo kind of that bear down that naturally happens anyways. And then here I am ticking and not even realizing how tight I would hold my stomach, kind of a hypertonic, pelvic floor. And then to a point where my belly expanded and I literally couldn't anymore. It
Yeah.
was a wild sensation, but
Yeah. It's
anyways.
it's a challenging time for sure. Taught me a lot about my body, so I'm really grateful for and a lot of trainers will say that, like, and they get an injury and we're, upset about it, but you end up learning so much for your clients through the process of recovering. So,
Also true. Katie, thank you so much. This was incredibly insightful, and I will post all of your links, your website, your courses. You have a membership. If you're an occupational therapist, if you're somebody with Tourette, I think her course is 100% worth looking into, and I encourage everybody to follow. And let's all keep moving. But
agreed. Thank you, Rachel. I really appreciate it. This was a wonderful interview.
thank you so much, Katie.
We love providing a platform for sharing ideas about living with Tourette syndrome and other tic disorders. While we strive to keep the content evidence based, please understand that exercise science, information about Tourette syndrome, and its co occurring conditions are constantly evolving. The content shared in this podcast are for informational purposes only and should not be considered medical advice. By listening to this podcast, you agree to not use the information as a substitute for professional medical advice or treatment for yourself or your child. As always, consult your healthcare provider before making any medical decisions or starting any treatments related to Tourette syndrome or other health conditions, which also includes mental health. This disclaimer also applies to any guests or contributors to the podcast. TickFit and the podcast team do not take any responsibility for any actions taken based on the information provided. Our goal is to educate, support, and raise awareness, not to diagnose or treat any medical condition. Thanks for listening.